I'm Dr. Frita, and today I'm giving you 5 tips on how to get off high blood pressure medications safely. Let me ask you this. Are you tired of taking your high blood pressure pills every single day? Do you sometimes ask yourself, is it even possible for me to get off of these medications for good? Well, for many people, the answer is yes. We know that high blood pressure is a leading cause of heart disease, strokes, and it's actually the number 2 cause of kidney failure. Yes, it's the number 2 reason why I take care of patients in my dialysis unit. We also know that while high blood pressure medications can be very effective in lowering blood pressure, they can also sometimes have some undesirable side effects, right? And so we're trying to find that balance. I'm a board certified kidney and high blood pressure doctor, and so I take care of patients with hypertension or high blood pressure every single day. And guess what? For many people, there are ways to actually get off of the medications. But here is the key, and here is the most important thing you're going to hear in this video. It is important that you consult with your doctor. And so I never want you to stop or change your medications without first consulting with your physician. And here's why. If you stop your medication and you're not under the supervision of your doctor, it could lead to extreme hypertension, which can cause you to have a stroke, a heart attack, worsen kidney function, or other complications, okay? And so I want you to think of this as a guide, as a way to start the conversation with your doctor. And so together as a team, you can try to be weaned off of these blood pressure medications, just like I've been able to help many of my patients be weaned off of their blood pressure medications over the years. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. Be sure to go ahead and like this video as we get started, because I'm about to give you some evidence-based medicine. How to get off high blood pressure medications safely. Number 1, consistent, moderate exercise. According to the American Heart Association, it is recommended that most adults get 150 minutes of moderate exercise per week. And so that averages to about 30 minutes, 5 days a week. And the exercise does not have to be super complicated, super complex. We know that when you exercise, that helps to release endorphins, it helps to decrease stress, and that's good for your blood pressure. It also helps you to maintain a healthy weight. And if you are a person who is living with a healthy weight, and if you're not living with obesity, then you're more likely to have a lower, healthier blood pressure. Also, consistent exercise helps you to have a stronger, healthier heart, and that can help to decrease the pressure in your vessels. So here are some simple ideas for exercise. Walking. Yes, a brisk walk. See if you can work in a 30-minute walk at least 5 days a week. And if you want some variety, incorporate the exercise throughout your day. For example, take the stairs instead of taking the elevator. When you go to the grocery store, park in a far parking space, and so you have to walk and get exercise on your way in. You can also take it and make it a family event. Go on a bike ride with your family. Have a dance party in your living room. Go ahead and check out some yoga and Tai Chi videos. If you have access to a gym, look and find a variety of exercises, strength training, try some different machines. I love sharing tips with you on how you can have a healthier, happier life. And here's one freebie that I have for you. It's a free PDF download on 10 healthy habits for a better you and a better life. These are habits that I incorporate into my own life so that I too can live my healthiest, happiest life. Click the link in my description or go to dr.frita.com, and I guarantee that these habits will help you on your health journey. You can also do some simple isometric exercises. In fact, isometric exercises have been found in studies to be one of the most effective ways to lower your blood pressure. By isometric exercises, I mean doing planks, wall sits, squats. Just make sure you find a way to incorporate exercise into your everyday life, because that is one way that could allow you to get off some high blood pressure medications. Question: what is your favorite way to fit exercise into your busy week? Please share tips down below. Number 2, drastically reduce your sodium intake. Yes, I'm sure you've heard that having a high salt diet is not good for you, but the thing is that a lot of the salt in your foods, it can be hidden salt. So many of you may be listening and you might be thinking, I don't add salt to my food, or I just use pink Himalayan salt or sea salt. Remember, sodium is sodium. So even if you're a person who uses pink salt, if you think you're using a salt that's healthier, and I will say that Himalayan salt does have some minerals to give it a different type of a health benefit, but it still has sodium. And so you need to watch the label and limit any kind of salt that you're taking in. According to the American Heart Association, it is recommended that most adults have less than 1,500 milligrams of sodium or salt per day. That might seem like a lot of salt, but it's not. If you think about this in terms of teaspoons, 1/4 of a teaspoon of salt is anywhere from 560 to 590 milligrams of sodium. And so even if you have 3/4 of a teaspoon of salt a day, you've already exceeded the daily recommended limit. So here's the real key. Make sure that you're a label watcher. And even in foods that you think might be healthy, sometimes there's hidden salt. For example, in canned foods, even if it's canned vegetables, they can be high in sodium. Frozen dinners. I know a lot of you like those frozen dinners that are lean, that are supposed to be low in calories, that are low in calories. But a lot of these frozen dinners are high in sodium. Of course, you know that fried foods and chips and French fries and all of those things are high in salt. But what about condiments? Yeah, you got to watch the salt in ketchup and definitely in soy sauce. My point is that it is important not just to dodge the obvious sources of salt, but make sure you're aware of that hidden sodium. And pulling back from that hidden sodium can help you to get off some of these high blood pressure medications. Here's the mechanism of how a high salt diet can cause you to be on high blood pressure medications. When you take in salt and that salt is inside of your blood vessels, then water follows the salt. And so you get excess water in those blood vessels. What happens when you have a high amount of water inside of blood vessels? Well, it pushes against the walls and increases the pressure inside of those blood vessels, leading to high blood pressure. And so if you want to come off of some of those high blood pressure medications, you definitely want to drastically reduce your sodium intake. Be sure to watch my video on 7 low sodium foods to help combat high blood pressure after you finish watching this video. Question: what is one simple, healthy food swap you have made that you now love? Please comment down below. Number 3, significantly limit your alcohol use. No, I don't want to be a fun snatcher, but I'm here to tell you the truth on how to get off of some of those high blood pressure medications. We know that excessive alcohol use can be linked to an increased high blood pressure. Even when you're using the alcohol, it can cause a temporary but sometimes significant spike in your blood pressure. And if you have a chronic use of alcohol, especially an excessive chronic overuse of alcohol, it can definitely lead to high blood pressure. And so yes, limiting the alcohol will be a great way to get off some of these high blood pressure medications. Now, I have to say that studies now show us that there is no recommended amount of alcohol. There's no officially safe amount of alcohol. But I will share some previous CDC recommendations on what was considered to be the upper limit of alcohol. No more than 1 drink a day for a woman, no more than 2 drinks a day for a man. And remember, you must know the definition of a drink. If I ask some of my patients, my male patients, hey, how much do you drink? They'll say, oh, I have 1 drink a day. But they might be talking about having a 16-ounce tumbler of dark liquor. That is not 1 drink. Here is the definition of a drink: 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of a more potent, stronger alcohol, like an 80 proof liquor, okay? Each of those is considered to be 1 drink. And so consult with your doctor, because again, there is no official recommended safe amount of alcohol, but I do know, and I can tell you that when it comes to your health, the less alcohol, the better, especially if you're trying to get off of blood pressure medications. Number 4, master stress management. Yes, we always talk about stress and how stress is bad for your health. Well, listen, it's real and there's science behind it. When you are stressed, you release stress hormones like cortisol. Cortisol can increase your blood pressure by causing your heart to beat faster and by causing your blood vessels to tighten. And so imagine if you're someone who gets road rage, or if you really get triggered and angry, or if the cashier at the grocery store, if they have an attitude that upsets you and you're stressed out, well, then that can cause a cortisol spike. It can cause an increase in your blood pressure. Let's take it a step farther. If you are a person who is chronically stressed, if just kind of things that are going on in your life, work issues, family issues, money issues, if these things have you in a chronic state of stress, then that could lead to you having chronic high blood pressure, and that could be why you are on so many high blood pressure medications. So yes, being masterful at reducing your stress is a great way to get off of high blood pressure medications safely. Here are some tips. 1, you want to organize your day. Make sure you give yourself a things to do list and prioritize the top 4 things on that list. You're not going to get everything done. And so make sure you prioritize things you want done for that day and give each thing a deadline. Even if it's a long-term goal, put a deadline on it, because things that don't have deadline oftentimes don't get done. Also, especially if you're a person who gets road rage, plan to leave your house early, 15 minutes earlier than you need to, 30 minutes earlier than you need to. This way, you'll be less stressed about getting to where you need to go, finding the meeting place, and that can help reduce your cortisol, which can reduce your blood pressure, which can help to get you off some of these medications. Another great thing, mindfulness techniques, okay? Learning how to meditate. And guess what? You can download one of these free apps on how to meditate. Doing exercises like yoga and Tai Chi can reduce stress. Also, just taking a brisk, peaceful walk in a quiet neighborhood or in a quiet place. And if you really have a high level of stress that you're having difficulty managing, even some form of anxiety, make sure you consult with your doctor and or a mental health professional. If you are able to successfully reduce your stress, then yes, that's one more key to being able to come off of blood pressure medications. To learn some of these yoga and Tai Chi moves and some slow, deep breathing and even progressive muscle relaxation, all things that can help you to manage stress, be sure to check out my video on the top 10 exercises to lower blood pressure the natural way after you finish watching this video. Number 5, the top diets for lowering blood pressure. Yes, what you put in your mouth matters. And so it's important to get on a diet or a lifestyle of eating that's going to help you to keep your blood pressure low and to reduce some of the medications that you're on. The DASH diet, dietary approaches to stopping hypertension. This diet is excellent for lowering blood pressure. It's not just a fad. It's not one of these fad diets. It's actually scientifically proven to help to reduce blood pressure. In the DASH diet, it's actually rather simple. The concept is, anyway, you focus on filling your plate with fruits and vegetables. You fill your plate mostly with these items, and then you have a portion of some lean proteins. If you eat meat, then those lean proteins would be things like fish or chicken, preferably white meat with no skin. And you definitely want to have a low amount of sodium in your everyday diet. Another great diet is the Mediterranean diet, which is full of healthy fats like olive oil. Make sure you consult with your doctor and your registered dietitian to find out which diet is best for you. And I guarantee if you're able to incorporate these healthy diets, then that is a great way to get off of high blood pressure medications. Food is medicine. I have a lot of patients who come in to see me, and on our first meeting, they'll say, "Doc, I don't want to be on any blood pressure medicines, or I really can't stand blood pressure medications." Listen, I'm a doctor, I understand. And even as a patient, I don't love medications, but the truth of the matter is that sometimes medications are necessary. Case in point, if you walk into my office and your blood pressure is 180 over 110, you have a headache and you're like, "I don't like being on medicine." Guess what? I'm going to recommend that you get on medications to get out of that stroke level hypertension. And then I'll also give you all of these tips on how to get off of blood pressure medicines. And as your blood pressure lowers, then we will wean you off of the medications. Some people don't like medications because they can have side effects. And yes, they absolutely can. Some can cause your feet and your ankles to swell. They can cause you to have a decreased libido. They can affect your love life. They can do all kinds of things. It's true. But do you know what else has side effects? High blood pressure. High blood pressure has the fatal side effects of causing heart attacks, strokes, and kidney failures, okay? And so we're always managing the pros and the cons. It is the most important thing to have your blood pressure under control, and so you can have a long, good quality life. So remember, this video is to serve as an inspiration and as a starting point for your conversation with your doctor. Again, please do not stop your medications or change your blood pressure medications without consulting your physician first. Also, remember to be patient with yourself. You're not going to walk in, implement tips, and then poof, automatically have perfect blood pressure. No, Rome was not built in a day, and neither was your high blood pressure. And so you have to have patience with yourself and patience with the process. Trust the process of lifestyle changes. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about. I appreciate you for watching. I always appreciate the support, and I want you to continue to do your best to live your healthiest, happiest life. I'm Dr. Frita.